Hi, I'm Chelsea Roy, and I'm going to be doing the head, ears, eyes, nose, and throat exam today. I have gathered my equipment, which includes a white piece of paper and my otoscope. Before coming in to meet the patient, I have my equipment gathered, and I have washed my hands, and I have provided privacy. When I first come in to my patient, I can observe a lot of things without even having to tell the patient. I can look at the general appearance. I can assess his nutritional status. I can also see about his personal hygiene, whether his clothing is appropriate for season and if it's clean or neat. I can see his skin color, but I'm also going to note that throughout the entire session. I can also look at his posture and position. Through this, I'm looking for his affect, his mood, his speech, and his hearing. Also, I'm observing for eye contact, level of consciousness, and orientation. The first thing I'm going to assess on my patient is his head. I'm going to have my patient look straight at me, and I'm looking for facial symmetry. Next, I'm going to inspect and palpate his cranium. I'm looking for hair distribution, but feeling for any deformities as well. I'm not feeling anything. The next thing I'm going to assess is his temporal arteries. And I do feel those on both sides, and they are equal. I'm going to come down to the temporal mandibular joint, and I'm going to have you open your mouth, have you open again, and I can feel both of those. While I'm here, I'm going to go ahead and assess his maxillary and frontal sinuses. I'm feeling for any swollenness. I'm also looking for tenderness. The next thing I'm going to assess on my patient is his eyes. I'm going to have him face me. During this time, I'm inspecting his eyes and the external structures. I can see his eyebrows and his eyelashes, and I'm not noticing any droopiness. I am now going to do a couple of tests with him. I have two pieces of paper here. I'm going to have him hold one, and I'm going to hold the other. The first one we're going to do is the confrontation test, and I want you to hold it up to your left eye, and I'm going to hold up mine over here, and I want you to let me know when you can see my finger. Okay, and I want you to cover your other eye, and we're going to do it again. Let me know when you can see my finger. Alright, I want you to hold that piece of paper, and I want you to cover one eye, and I want you to focus on my nose. And on the count of 3, I want you to remove it. 1, 2, 3. Perfect. And I want you to go to the other eye. 1, 2, 3. Perfect. I did not notice any weaknesses in his eyes. Now I'm going to have you follow my finger. Keep your head still and only use your eyes. Perfect. My patient is not showing any signs of weaknesses, and he was able to do all of the cardinal cases. During this time, I would let him do the Snellen chart. I do not have that available, but I would have him stand 20 feet away and read the smallest letters on the chart. If I had it available, I would use the ophthalmoscope to do my red reflexes and my corneal light reflexes, but unfortunately I'm not able to do that. So I have inspected my patient's eyes earlier, and I looked at the external structures, but now I'm wanting to inspect the inside. So I'm going to place my thumbs here, and I'm going to gently pull down on your eyelids. I'm assessing the sclera, which is white, his conjunctiva, the pupils, and the irises. I'm not noticing any issues. Perfect. And that concludes our eye exam. While I have my patient facing me, I am now going to inspect his ears. I'm going to inspect the external ear, looking for any lesions, drainage, and also inspecting the skin. I'm not noticing any abnormalities or tenderness. I'm also going to conduct the whisper test. I'm going to cover one ear, and I'm going to say one 2-syllable word on each side and have him repeat it. Baseball. And he passed the whisper test. So now I'm going to take my otoscope, and I'm going to use my light to inspect the inside of the ear. I'm looking at the canal and the tympanic membrane. I'm going to pull his ear out and up. I'm not noticing any abnormalities of his left ear. Again, I'm going to pull out and up and inspect. I was able to visualize the eardrum on both ears. So while I'm standing here, I am going to go ahead and inspect his nose. I'm looking for any symmetry or lesions. His nose is symmetrical to the rest of his face, and I do not notice any lesions. I am going to use the tip of my otoscope to inspect the inside. I'm being careful not to puncture anything in there because it is very vascular, and I am looking at mucosa and the septum. And I'm not noticing any abnormalities there. I'm now going to inspect my patient's neck. First, I'm looking at symmetry. I'm looking for masses, pulsations, and jugular venous distension. From my inspection, I am not noticing any masses or deformities. So now I'm going to palpate. I am looking first for his lymph nodes, and then I'm going to go to his carotid pulse, and then I'm going to assess his trachea and thyroid. So starting in front of the ear, coming behind, working my way down the jawline, and then I'm going to come down his neck. I'm not feeling any swollen lymph nodes, and I'm not noticing any tenderness in my patient. While I'm here, I'm going to assess the carotid pulse. Perfect. I'm also going to assess the trachea, which is midline, and I'm going to use the anterior approach to assess the thyroid. Can you take a big swallow for me? His thyroid glands are not swollen or tender. While I'm here, I'm going to lay my hands on your shoulders, and I want you to push up against the pressure. Perfect. I'm not noticing any muscle weakness. And now I'm going to test your range of motion. So I want you to take your left ear and pull it down to your shoulder. And I want your right ear down to your shoulder. I want you to look left and right. And then I would like you to look backwards and then forwards. I did not note any weaknesses in his range of motion. This will conclude my head, ears, eyes, nose, and throat